Most people over 60 think waking up at night to use the bathroom is just part of getting older, something you accept, something you live with. But what if I told you that one simple habit, something you're probably doing every single day without even thinking about it, is the exact reason your sleep is being cut short night after night? And here's what makes this even more surprising. It has nothing to do with how much water you drink. It has everything to do with when and how you drink it. Stay with me, because what you're about to hear could completely change the way you sleep, starting tonight. Hello, I'm Dr. Harrison, a urologist with over 2 decades of experience helping patients take back control of their bladder health and their sleep. Every single week, patients walk into my office exhausted, dark circles under their eyes, frustrated, and almost every one of them says the same thing. Dr. Harrison, I wake up 2, 3, sometimes 4 times a night just to use the bathroom. Is this normal? And my answer is always the same. It's common, but it is absolutely not something you just have to accept. Today I'm going to walk you through exactly what's happening inside your body at night, why your bladder keeps waking you up, and most importantly, the specific water drinking strategy that can help reduce those nighttime trips dramatically. This is the conversation I have with my patients every day, and I'm bringing it to you right here. Let's get into it. Part 1. What's actually happening when you wake up at night? First, let's talk about what's going on in your body. There's actually a medical term for waking up 1 or more times at night to urinate. It's called nocturia, and it is one of the most common complaints I hear from men and women over the age of 50. Now, a lot of people assume nocturia is just about the bladder getting weaker with age, and yes, that can be a factor. But here's what surprises most people. The bigger issue is often how the body handles fluids at night. Here's something fascinating. When you're young, your body produces a hormone called ADH, antidiuretic hormone. This hormone tells your kidneys to slow down urine production while you sleep. So your body essentially helps you stay asleep by reducing how much urine your bladder has to handle. But as we get older, especially after 50, the production of this hormone can decrease. That means your kidneys don't slow down as much at night. They keep producing urine at a rate closer to what they do during the day. And the result? Your bladder fills up faster while you're sleeping. Now here's where it gets really important, and this is the part most people never hear. The timing of your fluid intake during the day plays a massive role in how much urine your body is producing while you sleep. When you drink a large amount of fluids in the evening, say after 6 p.m., your kidneys are processing all of that fluid and sending it straight to your bladder while you're lying in bed trying to sleep. It's really that simple. And yet, almost nobody connects those dots. But wait, because there's another layer to this, and it involves something you might not expect at all. Stick with me, because this next part is where things get really interesting. Part 2. The hidden mistakes most people over 50 are making. Here's where I see the biggest mistakes, and I see these every single day in my practice. Mistake number 1. People are not drinking enough water during the first half of the day. This is incredibly common. People wake up, maybe have a cup of coffee, get busy with the morning, and before they know it, it's 2 in the afternoon, and they've barely had any water. So then what happens? They drink a lot in the afternoon and evening to make up for it, and by the time they go to bed, their body is still processing all of that fluid. Your kidneys didn't get a chance to do that work earlier in the day, so they do it at night, while you're trying to sleep. Mistake number 2, and this one shocks a lot of my patients, is drinking too much fluid right before bed, even healthy drinks. I hear it all the time. Dr. Harrison, I drink herbal tea at night to relax, or I have a big glass of water right before bed because I don't want to get dehydrated overnight. I completely understand the thinking, but the timing is working against your sleep. Any significant amount of fluid taken within 2 to 3 hours of bedtime has to be processed while you sleep. And your bladder will absolutely let you know about it. Mistake number 3, and this one is the sneaky one, is alcohol and caffeine in the evening. Both alcohol and caffeine are diuretics. That means they actually stimulate your kidneys to produce more urine. So that evening glass of wine or that late afternoon coffee is doing double duty. It's adding fluid to your system and telling your kidneys to speed up production. The combination is a recipe for multiple nighttime bathroom trips. And here's something that surprises almost everyone. Alcohol may make you feel sleepy, but it actually disrupts the hormone I mentioned earlier, ADH. So it directly reduces your body's natural ability to slow down urine production while you sleep. That's a big deal. Now, are there other factors at play? Absolutely, and I'll get to those. But right now, I want to give you the actual solution, because that's why you're here. Part 3. The right way to drink water. The timing strategy that changes everything. All right, here is what I tell my patients. This is the water timing strategy that has made a real difference for so many people over 50 who were struggling with nocturia. Step 1. Front-load your fluids. The goal is to get the majority of your daily fluid intake done in the morning and early afternoon. Ideally, aim to drink most of your water before 2 p.m. This gives your kidneys the whole day to process everything while you're awake and active. By the time evening rolls around, your body has already done most of that work. Think of it like this. Your kidneys are workers. If you give them all the work in the morning, they finish by evening. But if you hand them a big pile of work at 8 p.m., they're going to be working all night. Now here's a question I want you to think about. How much water are you actually drinking before noon today? Most people are surprised when they really pay attention to this. Let me know in the comments. Step 2. Set a fluid cut-off time. This is one of the most effective strategies I recommend. Set a personal cut-off time for large amounts of fluid, typically 2 to 3 hours before you go to bed. So if you usually go to sleep around 10 p.m., your goal is to stop drinking significant amounts of fluid by around 7 or 7:30 p.m. Now, I'm not saying you can't take a small sip of water to take medication or wet your mouth. That's fine. I'm talking about glasses of water, tea, juice, or any significant fluid intake. That is what you want to cut off in the evening. Step 3. Watch the diuretics. As I mentioned, caffeine and alcohol are diuretics. After 2 p.m., try to limit caffeine. And if you choose to have alcohol in the evening, understand that it's likely going to affect your nighttime bathroom trips, and try to compensate by keeping the amount small. Some of my patients are shocked at what a difference cutting out that evening glass of wine makes on their sleep quality. It's not always easy to hear, but it's the truth. Step 4. Spread your intake evenly through the morning. Don't chug water. Your kidneys work better when fluid comes in steadily, not all at once. Try to sip water consistently throughout the morning hours, rather than drinking a large amount all in one sitting. This helps your kidneys stay on pace and process fluids efficiently without creating a sudden surge. Step 5. Do a bladder void before bed. This sounds simple, but many people skip it or don't do it intentionally. About 30 minutes before bed, go to the bathroom and empty your bladder completely. Don't rush it. Give yourself a moment to make sure you've fully emptied. This gives you a clean start for the night and reduces the chance that a partially full bladder wakes you up within the first couple hours of sleep. And one more thing, stay with me because this next part is important and most people don't know about it. Part 4. The leg elevation secret. Here is something I share with my patients that is not commonly talked about but makes a real difference. During the day, if you spend time sitting, especially with your feet down, fluid naturally pools in your legs. You may notice some mild swelling in your ankles or feet by the end of the day. That's very common in people over 50. Now here's the key part. When you lie down at night, that fluid that was stored in your legs gets reabsorbed back into your bloodstream. And your kidneys, doing their job, process it and send it to your bladder. This is one of the reasons people wake up to urinate within the first 1 to 2 hours of falling asleep. The solution? In the late afternoon, ideally around 4 or 5 p.m., try elevating your legs for 30 to 60 minutes. Just prop them up on a pillow or a footrest while you're sitting or lying down. This encourages that fluid to drain before you go to sleep, so it's not sitting in your legs waiting to rush to your kidneys the moment you lie down. This one tip alone has helped many of my patients reduce their nighttime trips, and it costs nothing. Have you ever tried this before? Let me know in the comments. I'd love to hear your experience. Part 5. What else could be causing nocturia? Now, I want to be honest with you because I believe you deserve the full picture. While the water timing strategy I've shared today is highly effective for many people, nocturia can sometimes be related to other health conditions, and those deserve attention. Conditions like an overactive bladder, an enlarged prostate in men, urinary tract infections, diabetes, heart conditions, and sleep apnea can all contribute to waking up at night. If you've tried adjusting your fluid habits and you're still waking up multiple times every night, please talk to your doctor. This is something a healthcare professional should evaluate, because there may be a treatable underlying cause. The strategies I've shared today can absolutely make a difference, but they work best alongside proper medical care, not instead of it. Part 6. Putting it all together, your nighttime plan. Let me summarize exactly what to do starting today. Number 1. Drink most of your water before 2 p.m. Front-load your fluids. Number 2. Set a fluid cutoff of 2 to 3 hours before bed. Small sips are fine, large amounts are not. Number 3. Limit caffeine after 2 p.m. and be mindful of alcohol in the evening. Number 4. Sip water consistently in the morning rather than drinking large amounts at once. Number 5. Elevate your legs in the late afternoon for 30 to 60 minutes to drain fluid from your lower body before bed. Number 6. Always empty your bladder completely about 30 minutes before going to sleep. These are practical, evidence-based strategies. They're not complicated, but they do require consistency. Give them at least 1 to 2 weeks and pay attention to the difference. Getting up multiple times at night is exhausting. It chips away at your energy, your mood, your focus, and your overall health. And for years, so many people over 50 have just been told, that's just what happens when you get older. Accept it. But that's not the full story. Your habits, especially when and how you drink water, have a powerful influence over what happens when you close your eyes at night. You deserve restful sleep. And the good news is, with a few intentional changes, many people see real improvement. If this video helped you today, please give it a thumbs up and share it with someone who you know is struggling with this. And drop your age in the comments. I love hearing from this community, and your experiences help others too. Take care of yourself, and I'll see you in the next one.